Good morning, everyone. This is the February 12th, 2021 health update from the Drive with John program. Stay tuned for updates on vaccines and the pandemic case information from Director of Nursing, Heather York, and our Health Director, Sheryl Ball.
Good morning, everyone. It's nice to see you. So the numbers for Acton up to date since last March, we've had 717 overall positive cases in town. We currently have 25 residents on isolation. A number of those have contacts that are also on quarantine. 661 residents have recovered, and sadly, 31 residents of Acton have passed since the beginning of the pandemic. The trend we're still seeing for public health contact tracing is household spread in town. So members of the same household or folks that are doing things outside of their direct household members with other, whether it's relatives or friends in another household. That's the spread that we're seeing primarily in Acton. I wanted to just touch a little bit on vaccines, and Sheryl is going to talk some more about them. Both the Pfizer and the Moderna vaccine required a 2-dose series, as you all know. You should definitely plan ahead when you're scheduling your appointment for your first dose, knowing that you need to go back to the same site for your second dose. This has been highly advertised and especially to us as a Board of Health who will be doing some of these vaccines. As your clinic location orders the second doses separately than we order first doses. So knowing who came to a clinic or a doctor's office, that location will then order that second dose based on those numbers that they have. So it is important to go back to your original site. After the vaccine, after you received it, you should monitor yourself as you can have mild symptoms, and the symptoms you should look for, and they should really be minor, are injection site swelling and redness, and also discomfort. You can have some symptoms that mirror the symptoms of COVID, which include fever, sore throat, muscle aches and pains, and sometimes a cough, but these should be very, very mild and shouldn't last for more than 2 to 3 days if you do get them. We've been hearing very mild symptoms from folks in the community, so that's good news. Anything beyond that significantly is a symptom of COVID, where you have a high fever for a few days, you develop a cough or any of the other symptoms, you should consider that you may have been exposed prior to your vaccine, and you should contact your doctor and get tested to make sure that you don't have an active virus. So that's really important. After vaccine, very minor symptoms, but if you do have significant symptoms, you should reach out to your doctor. A couple of other things about after vaccination, you should definitely continue to wear a mask and social distance as we're doing now to help reduce the spread. Avoiding crowds and then avoiding poorly ventilated areas is also important to continue to do. It takes time for your body to build protection from any vaccine, and that's still the same for COVID. After your second dose, you are considered protected from the virus about 2 weeks after that second shot. So even after you get that second vaccine, continue to do all of those things that we've been doing all along to make sure that you don't get exposed right after you've received the vaccine. And again, significant symptoms of COVID, please reach out to your doctor because you may have an active virus going on. So I hope everyone is getting their scheduled appointments and staying safe. And I will see you next week. And Sheryl's going to continue on with the public health update.
Hi, good morning, everybody. So thank you for having me. So vaccine is our hot topic today. So I would like to talk about some things that the town has done as well as what the state's doing. So I just want to let you all know that the town is continuing to request vaccine every week, and we sincerely hope that we will be able to get some. We don't want our residents to have to travel far to the mass vaccination sites, that I'll mention in a minute. So we've developed a vaccine working group that consists of Anita Arnhem. She's our Deputy Fire Chief and our Emergency Management Director. Sharon Mercurio, our Council on Aging Director. Heather York, our Nursing Director. John Mangiaratti, our Town Manager, and myself. We meet multiple times per week and are ready and able to conduct vaccine clinics once we obtain additional vaccine. Any future clinics that we have will be held at the junior high cafeterias. Unfortunately, we have only obtained 100 doses of vaccine, and these were used to vaccinate our senior housing residents over 75 and our homebound residents. We anticipate that once we are allotted vaccine again, that we will receive more than 100 doses. And we want to ensure that if we continue to only receive small amounts of vaccine, that they will go to our most vulnerable population. Our primary focus will be on our oldest, most vulnerable, and those without access. Rather than offering the vaccine to companions, we would ask that those that may not have access to a ride to call the town hotline at 978-929-6600 to determine if we can provide alternate plans for you. The town is also maintaining a vaccine interest form that you can find on actonma.gov. Click on the COVID-19 located at the top of the page, and then you will find the link to the form under the blue COVID-19 square on that page. This form is for residents identified in the first two bullets of phase 2 to complete. Once the state moves on to the other subgroups, we will update this interest form to include others. I encourage all that are eligible to complete this form, as we will use this to continue to reach out to certain subgroups once we have additional vaccine. So the next step, I'm going to talk about the mass vaccination sites. So as you may know, yesterday, companions and caregivers of those over 75 plus can now get the COVID-19 vaccine. You can go to the mass.gov/COVID vaccine website, and you can schedule 2 separate appointments at either the same time or adjacent. For the companion appointment, you're going to need to select the option, I'm accompanying someone who is 75 plus in their vaccination appointment, and my appointment is the same day. If individuals are unable or to use or have difficulty accessing the internet, they may call the 211 hotline that the state is providing for assistance in booking both those appointments. Only one caregiver is permitted to schedule an appointment with the 75 plus resident. A caregiver may receive the first dose of the vaccine if the 75 plus resident is receiving their second dose. So right now, there are appointments for next week at 4 mass vaccination locations, which include Gillette, Fenway, Springfield, and Danvers. 2 additional mass vaccination sites will be opening in Natick and Dartmouth. So you can all schedule an appointment at those at mass.gov/COVID-19-vaccine. Additionally, we're expecting our major chain pharmacies to receive the vaccine this week as well. So we're hoping that with these mass vaccination sites and with the ability for the town to obtain vaccine, that we'll be able to the town will be able to get to our most vulnerable, and people that may not have limitations could utilize a mass vaccination site. So that's all I have. Thank you, and stay safe, everybody.
Thank you, Sheryl, and thank you, Heather, for those updates. Actually, before we move on to our next topic, we got a call from a resident actually about the vaccination, and there's just some confusion about the rules as it relates to your second vaccine. Heather, can you, I think you're familiar with the question. Would you mind just framing that and answering it for us, please?
Sure, John, thank you. So the first part of that question I did cover earlier, but we'll repeat it. So the state is recommending that you go to the same site for your first and second dose of vaccination. And that's based on the clinic areas ordering first and second doses from the state as separate orders. So they'll be ordering a new first dose amount and also a second dose amount for clinics that they've already given. So it is important to go back to the same site, and that's on the mass.gov website. You can look that up for information, but they still are recommending that. The second part of that question was about injectables around the time of your COVID vaccination. So what I know from this is that anyone getting another vaccine should wait at least 2 weeks after getting the COVID vaccine. And that goes to, you should really wait until after the second dose. It shouldn't be in between the first dose, as the Pfizer vaccine is only 3 weeks apart and the Moderna is 28 days. So that puts you in an awkward spot where you shouldn't get other vaccinations between the first and second dose. You should really wait for 2 weeks after your second dose to get any other vaccine. As opposed to other injectables, such as other injectable medications or cortisone shots, I would refer people to their physician. That information is not readily available on the vaccine insert sheet. It just talks about other vaccines and the timing with the COVID vaccination. Thank you.